Right. Fantastic. Good evening, everyone. And thank you so much for taking time out to join us here today. Let me quickly start off by introducing myself. I'm Tejas, and I represent the product marketing function here at Plum. Now, while most of you are probably familiar with Plum, I hope you all are, I'll just give you a quick introduction to who we are and what we do. So Plum is India's leading employee group health insurance and health benefits startups. We make it extremely easy for companies of all sizes to purchase health insurance plans and health benefits plans for their employees, as well as make it extremely easy for their employees to access and utilize their health insurance and health benefits. We're proud to say that we count over 1,800 of India's leading companies as our customers. Now, coming to today's topic and why we're doing this, right? I'm sure you've all heard about monkeypox. It's all over the news. There's a lot of things doing the rounds on social media, on WhatsApp, even, right? But how much of this can you count as actual credible information? We don't know that, right? But we at Plum want to be that trusted, credible healthcare partner of yours, being there for you in times of need with you, your teams, and your families. And who better to do that than our own in-house doctors on Plum Telehealth? Today we have with us here Dr. Ruby Taparia. A quick introduction to Dr. Ruby. She has completed her DNB in General Medicine from KEM Hospital in Pune, followed by a Senior Residency in Rheumatology at the Nizam Institute of Medical Sciences in Hyderabad, and she's currently pursuing her career in rheumatology. So Dr. Ruby and I are going to keep this super conversational, but before we kick things off, a couple of things for you to know and a couple of housekeeping rules as well. If you're a Plum member, do know that we have this service called Plum Telehealth, which brings you unlimited free doctor consultations available to you, your family members, on demand, absolutely anytime. All you need to do is log into your Plum dashboard and schedule a consultation. We have doctors available across 20 plus specialties, and Dr. Ruby is one of them. We have taken pre-recorded questions for this event. But time permitting, we will also take in live questions that you put in on the chat box. So do keep putting those in. The last thing before we kick things off, this event is being recorded. So in a few days' time after you've attended this event, you will receive links to it. So feel free to share this with your colleagues, share it among your teams in office to make sure that they're getting the most credible information out there. So, all right, with that, over to you, Dr. Ruby. So thank you so much for being here, first of all. And
Hello, everybody.
Yeah, sorry, go for it.
Good evening, everyone. Thanks for joining in. I think this is extremely important and a great initiative by Plum to spread the right information, because I feel these days off late, especially post-COVID, we have a lot of circulating media, news channels, social media outlets where we don't end up getting the right information and we tend to panic because of that. So this is a great opportunity by Plum. So thanks to that. And I hope that all of you get something out of this conversation, and I'll be willing to answer anything that you have according to my own expertise.
Fantastic. So let's start off by addressing the elephant in the room, the reason for all of us to be here. What is monkeypox?
Right. So I think we're going to keep this very simple, very casual, and I'll really try to keep it very basic. At any point that anywhere you all don't understand something, please note it down and get back to me at the end of the once we finish our chat. So monkeypox is a zoonotic infection. By zoonotic, I mean it is something that gets transmitted from animals to humans. So this is not a new infection. It has been present since decades. It's mostly seen in Africa, where it was endemic. A common term you would have heard prior to this is smallpox, which has been eradicated now. And this comes from the same family of viruses. So what had happened was when smallpox was eradicated because of successful vaccination, it also provided protection towards monkeypox. But now that there is a decline in vaccination because it's been eradicated, these cases have been coming up now and then, but it's mostly endemic in Africa and no other country as of now. The smallpox, the name monkeypox has come because it was first identified in monkeys in laboratories. It's commonly seen in animals, the common animals being squirrels, rats, monkeys, and apes. Human infection is very rare, but suddenly we've seen a lot of cases coming up the last couple of months.
Fantastic. Now that you mentioned, human infection is very rare, but we have actually, seen these cases, these outbreaks happening in the last couple of months. Could you walk us through how it is actually getting transmitted?
So, like I said, it comes from animals. So the primary source is from animals to humans. Now, the common animals being mostly are the wild animals like rats, squirrels, and monkeys. So what we need, most of the time, it's because of contact with these infected animals, either via their contact with the body, their blood, or their bodily fluids. Second thing, which probably doesn't apply to the Indian scenario as such, is but it's very relevant outside, is eating raw uncooked meat. So if an animal is infected and you end up eating raw meat of that animal, you do have chances of acquiring that infection. Second is human transmission. So when a person is infected, there are two ways you can get infected from a contact. One is via respiratory secretions and second is via skin. Now, respiratory secretion is not the way COVID has been. These are larger droplets which don't travel, they don't have airborne transmission. So you need to be in contact with a person in a particular room for a longer duration of time to acquire the infection. Second is when you come in contact with their skin lesions, that is when you may possibly end up getting the infection. There is chances that when a mother is pregnant and she has an infection, there are reports where it can get transmitted to the fetus also. But the last couple of months, there are no reported cases of the same.
Great. Now, this makes it the perfect time to also, segue into, because we mentioned human to human transmission. So what are some of the symptoms of monkeypox that we see in both adults and children?
So the incubation period is when you come in contact with an infected patient till the time you develop symptoms is about 1 to 2 weeks, maximum of 3 weeks. This is the period where you're supposed to be vigilant about your symptoms. There are two phases to this. One is an invasive phase and one is when you get the rash. In the first initial phase, you end up getting very high grade fever, about 102, 103 degrees Fahrenheit, with chills, a lot of body aches, a lot of muscle pains. One differentiating point I want you to be aware of is there is a lymph node enlargement in monkeypox, which is not seen in other viral infections like chickenpox, measles, dengue, the commoner ones. What is lymph node enlargement? So all of us have lymph nodes in the body, commonly located in the neck area, the axilla, and the groin. These are basically nodes which hold WBCs, which are your white cells, and they end up enlarging whenever you're having any infection. So in monkeypox, this is one of the soft indicators where you can have a lymph node enlargement versus trying to separate it from the other infections. After about 1 to 3 days of fever, you will end up getting the second phase, which is the rash, which is very pathognomic. Here you will have first a flat lesion, which is typically seen on the face and the hands and feet. This has to be kept in mind to differentiate from chickenpox, which starts from the trunk and then spreads peripherally. So it starts as a flat lesion on the skin, then it becomes a little bit raised, then it becomes like a fluid filled pustule, which kind of has a crust over it, dries off and falls. So the lesions are quite similar to what we've seen in chickenpox, but the distribution in the body is different. It's seen predominantly in the hands, feet, and the face. Chickenpox starts in the trunk and then moves peripherally, usually ends up sparing the palms and soles. So this is a soft pointer again to differentiate between the two. Of course, this infection is very self-limited. If even if you get monkeypox, the symptoms may last for about 2 to 4 weeks and it subsides. The case fatality, as in deaths or complications, are very, very rare. None so far reported in the last couple of months. All patients have had just common symptoms of fever, rash, and have been discharged without any complications. Reported from Africa, where the disease is endemic, there is a case fatality, which is death, in less than 1% of the patients. So it's not a very fatal disease. There's not high mortality. It is nothing like COVID. So I think like the panic that is associated with COVID doesn't apply to monkeypox.
Thank you so much, Dr. Ruby. One point that we should probably be touching upon here is are there different symptoms when it comes to adults and children, or is it both roughly the same?
So both of them are roughly the same. I would say children are a little more susceptible because of reduced immunity. When a child is growing, their immune system is not well formed. They are more likely to get viral infections. But at the same time, it's not like they may end up getting a more severe disease in the terms of symptoms like the fever and the rash. But again, mortality is not higher in children compared to adults. So pretty much the same disease, pretty much the same symptoms as well as the outcomes.
Got it. And now coming to the do's and don'ts. Again, this is an area where there's a lot of information, a lot of misinformation that's usually doing the rounds on the news, on social media, and probably the worst of all being WhatsApp. But if you could tell us, practically and credibly, what are some of the most effective do's and don'ts that actually could protect you from monkeypox, if at all?
So, like I had mentioned, I've educated you to a certain extent on how it spreads. So, first thing of utmost importance is to be aware of a disease called monkeypox. What are the symptoms you need to be looking for? Every rash that comes, every fever that comes will not mean chickenpox or monkeypox. It is one of a rarer diseases. So, we don't have to really panic. Just be aware of an entity called monkeypox that exists. So, awareness is most important and getting the right information, of course. Second thing to be done is because we know it comes from humans as well as animals. As far as humans are concerned, if you have an infected patient at home or even in a hospital setting, you need to minimize the contact. So, herein again, COVID precautions come into rule. Respiratory hygiene and hand hygiene. By respiratory hygiene, if you come in contact with a person, this is not applicable to a larger public area, but when you come in contact with a person who's infected or suspected to be infected with monkeypox, please wear a mask, a surgical or an N95 mask. Second is hand hygiene, regular washing of hand using sanitizers and minimizing the contact with a patient who's proven or suspected. Second is animals. So, of course, do not eat uncooked raw meat. Whether it is, I mean, of course, there's no Indian practice of eating these kind of wild animals that are the reservoirs or sources. But at the same time, we need to be watchful for it because that is the main source where it comes from. And you need to make sure that you minimize the contact with these animals, which is squirrels, rats. See, these are mainly seen in a laboratory setting in our country. There is, I don't think there's a lot of hunting that goes on in our country. Or so this is mostly for healthcare workers where you need to minimize contact with patients and animals who are known to be infected or suspected to be infected. For information regarding monkeypox, my sincere advice would be to get to the right sources. That would be the Ministry of Health and Welfare as well as the Indian Council of Medical Research. I'll talk more about this at the end of the session.
Thank you so much, Dr. Ruby. I was just about to ask that, if people had to actually go and look for these credible sources of information, where should they be going? But looks like you've got that in your mind already, and you will address that for the audience. So coming to one other, hotly, question that people really want to know is, are there vaccines for monkeypox? This seems to be something that's come in on the chat box. This is something we've discussed earlier, and it probably came in the audience questions on the link as well. So this is something everybody would like to know more about.
So yes, that's the good news. We do have vaccines in place. So like I'd mentioned, monkeypox is an old disease. It's not new. It's not leaked from any laboratory. It's no countries to be blamed here. It is an existing genetic sequence from Africa, which has been spread to other countries, likely because of travel and animal sources. So a vaccine does exist. United States does have that vaccine because US has seen, prior to this particular episode, outbreaks back in 2003 as well as in 2019, and they were very successfully able to control it with the help of vaccinations and treatment. As of now, there's a vaccine called Imvanex which provides about 85% of protection against monkeypox. Other than that, there are already pharmaceutical companies who are actively trying to make new vaccines as well as ramp up the production of vaccine early on because of the spread. So I think countries in Europe have already started procuring it because they have a higher caseload as of now. Germany, Spain, UK are the ones who have a high disease load as of now compared to other countries, and they've already been vaccinating groups which are infected as well as close contacts.
Got it. Thank you so much. I think that's allayed, some of the fears that the audience may have had. So now coming to, again, what's probably the most important thing over here, because we've talked about how it spreads, what are the symptoms, are there vaccines for it? But if, hypothetically, somebody were to actually contract this infection, what are some of the treatments available for monkeypox?
So, see, like I said, the infection is self-limited, right? So, first of all, you need to pay attention to the symptoms. You have fever, you treat that. You have a rash, you treat the rash. But luckily, we do have antivirals in place. Unfortunately, not in our country at the moment, but there are antivirals in place available outside, which have been tested successfully against monkeypox and do help in shortening the duration of the disease as well as preventing infections. It's not a preventive treatment. It's not to be used as a prophylaxis. Like if you come in contact, you don't end up using that medication. But of course, when you do get the infection, there are medications available. So I'm hoping if we do end up getting cases in our country, hopefully those medications will be made available at that point of time.
Got it. And sort of now that you actually, mentioned India, you mentioned, the hope that some of these treatments, some of these vaccines might actually make it to the Indian shores soon. Could you walk us through what is the current Indian scenario for monkeypox? Because again, this is a topic where information is quite literally all over the place. So hearing it from you, hearing it from the horse's mouth would probably be the best thing for all our viewers here.
So I think in the last few days, I've come across one article where a young girl from Ghaziabad, Uttar Pradesh, was suspected to have monkeypox because she has lesions, skin lesions similar to what monkeypox has. Fortunately, a virus sample was taken. So this is also tested by an RT-PCR, but here it is not a nasal swab or an oral swab. This is a swab from the skin lesion, which is sent for testing to the National Institute of Virology in Pune. The girl has tested negative. So as of now, as we speak, we have 0 cases of monkeypox in the country. The guidelines given a couple of days ago by the Ministry of Health and Welfare are to just be aware. See, we have countries who have higher caseloads. So to avoid travel to these countries as much as possible, if you need to, of course, you may go ahead. But once you come back, you just need to be vigilant for at least 3 weeks once you come back of the symptoms, which is, again, fever, severe body ache, lymphadenopathy, which is lymph node enlargement, followed by the typical rash that we see over the extremities as well as the face. And if you do, you can contact the nearest health authorities because this has to be proven via testing, and then only appropriate treatment has to be taken.
Got
So
it.
as of now, yeah, we're very positive that we don't have any cases. And just extrapolating from what has happened in the past in the United States, there have been 2 outbreaks and they've been able to contain it successfully without much hindrance, without much fatality or deaths. So that's a very positive factor. One thing I would like to say also here is I do not expect this to, ramp up like COVID or go out of proportion because it's an existing disease that we know of. COVID was a surprise. None of us knew what we were dealing with, and we were gradually getting information while we were dealing with it. But as of now, we'd have a lot of preliminary data on monkeypox vaccines as well as treatment available. So we don't think it will blow out of proportion and become a pandemic.
Got it. Thank you so much for those reassuring words, Dr. Ruby. Before we jump into questions from the audience, is there anything else that you'd like to add?
So like I wanted to mention the sources, the right kind of sources to go for any health information, monkeypox or otherwise. Please go to credible websites. The Ministry of Health and Welfare publishes guidelines on every disease which is endemic or a pandemic related to the country per se, as well as outside. If you want, the Indian Council of Medical Research, ICMR, also publishes the same. For credible international sources, there is CDC from USA, as well as WHO, of course. So these are the proper places to go to for information because from what we've learned in COVID is there was a lot of misinformation, a lot of panic created, and a lot of things taken, done by mistake or willingly or whatever it was the scenario, that shouldn't be repeated again. I think it's a learning lesson for all of us that let's get the right information and spread the right information rather than believing, anybody who doesn't really know. If you're well read and you want to spread information about it, please do go ahead, but get the source like from the right place.
All right. Thank you so much for that. Now let's quickly jump into the audience questions. But before that, small reminder for everyone, you can still put in your questions on the chat box. And apart from that, I've also dropped a link to the Plum teleconsultation homepage. So for those of you who would ever like to book a teleconsultation with Plum, if you're a Plum member, do go on ahead and use that particular link to access doctors across all of our specialties. Now coming to the first question that we have, this came in via the link that was provided on the email. So the question is, are kids who are recently vaccinated with MMR immune against this virus?
No. So see, MMR is measles, mumps, and rubella. Those are three different viruses from a different family. They are not related to monkeypox. So no, if I think everyone in your lifetime will be vaccinated with MMR vaccine because it's a part of the protocol. So that doesn't provide protection against monkeypox.
Got it. And I think you've already answered this question, but just to double click on it once again, the question says, which age group is more vulnerable to be affected by monkeypox? And will it peak like COVID-19? Will it cause death in worst case scenarios?
Right. So susceptible age groups, younger age and adults. Elderly are sort of like immune to it to a certain extent because pre-1980, people were vaccinated with smallpox, and smallpox vaccine does provide protection against monkeypox. So the target group here would be younger people, including children as well as adults. I think I've covered the COVID-19. I do not think that this is going to blow out of proportion like COVID because this is something we know of. We have measures in place to bring it into control. So unlikely. Death, of course, can occur in any viral infection, but it's very rare in monkeypox. If you are immunosuppressed, you have a lot of other issues, you're on medications which make your immune system weak, cancer therapies, autoimmune conditions, then likely your disease may be a little more serious comparatively. But at a larger level of the population, we expect this to be a very mild disease, which should subside within 2 to 4 weeks.
Got it. So now moving on to the questions which were put in on the chat box here. I'm skipping a couple of questions that were put on the on the email because they are also here on the chat box. So Sumit here has a question which says, what is its transmission rate? There's two parts to it. That's the first part of the question. The second part says, if a person had taken a vaccine at a younger age, can this person still get monkeypox? I'm assuming Sumit means a vaccine for monkeypox.
Right. Yes. So the first part, transmission rate, as of now, what reports we're getting from UK is one person who has contracted the infection can affect about 6 to 9 close contacts. So, but this is just very preliminary data because we don't have data like how we have in COVID, since these are just clusters of cases in different countries. But people are aware of it. They're getting isolated immediately. So we don't expect it to be transmitted. As long as you maintain the precautions of isolation, this is not airborne. So it's unlikely to spread to a larger community. And I think the second part, if a vaccine, yes. So I think the similar thing, if you had taken smallpox vaccine pre-1980 era, it was given to everybody, you would have had protection against monkeypox. Because smallpox was eradicated in 1980, the vaccine was stopped being given to everyone. And now is just for research purposes in laboratories.
Got it. Thank you so much. So now coming to Soumya's question, Soumya asks, in Karnataka, KFD is commonly called monkey fever. How similar or different is this monkeypox from KFD disease? Because the spread, symptoms, and treatments look similar.
Right. So KFD, see, all of these are viral infections. Your KFD, your dengue, your chickenpox, all of these are different viruses and they have very similar symptoms, very commonly looking symptoms, which are quite confusing to someone who probably hasn't seen a lot of cases. But this is different. The virus, KFD virus, is different from monkeypox. Monkeypox comes from vaccinia virus, the similar family to smallpox. But KFD comes from a different virus. It's called KFD virus itself. It's, of course, this host is the same monkey, but it doesn't mean that this is a very particular region in Karnataka which has cases of this. KFD is very, very rare outside this particular belt of the forest. So it's different. Symptom wise, it's the same because most viruses behave the same way. Fever, rashes, lot of malaise, lot of weakness, lot of joint pains and body aches. But there are tests to differentiate between each.
Got it. And I think, while we still wait for more questions to come in on the Zoom chat, if we don't have any more, I believe what we have might probably be the last question here, which again goes back to the relationship between chickenpox and monkeypox. And I'll just club the two questions because there was one that came in on the email as well. So the questions that came in on the email said, how is it related to chickenpox, if at all? Does earlier infection with chickenpox help in immunity against monkeypox? And Dinesh has also put in this similar question on the Zoom chat, wherein he asks, I believe chickenpox also has lymph nodes, like a kind of heat boils. Is that correct? And what are some of the precautions that we can take to build immunity? So I think that would probably be a great way to wrap up because, again, informing everyone of the precautions that we can take to stay safe against monkeypox would really drive the point home of doing this session.
So see, chickenpox and monkeypox are very different, even though they sound like different kinds of poxes. Chickenpox is varicella, if I'm getting into medical terms, which is a different virus, and monkeypox is vaccinia, again, similar sounding names. Chickenpox is commonly seen in childhood. Most of the people get it in childhood and they become immune to it unless your immune system is not functioning well because of several reasons in adulthood, then you may acquire an infection. No, so chickenpox does not cause lymph node enlargement. The heat balls you're talking about are the skin lesions that are seen in the trunk at the back. It starts there and then it moves on in the peripheries. Lymph nodes are not something visible, but it can be palpated. So it'll be like a palpable small nodular mass in your neck, in your axilla, or in your groin area. So chickenpox does not have lymph node enlargement. I think that answers the chickenpox and monkeypox. The vaccine thing, chickenpox vaccine doesn't cover monkeypox because they're two different families of viruses. The only virus that does help against monkeypox is smallpox, which has been eradicated successfully because of a large vaccination drive prior to 1980. So if you have adults at home, elderly people who are, pre-1980 era, they would have been vaccinated with smallpox and they are the ones who would have some amount of protection against monkeypox. So I think I'll end this session with what measures we can take together to not make it as bad as how we've dealt with COVID. I don't think there is a need for panic or alarm at the moment. Our country has 0 cases. What is needed is to be aware of what monkeypox is, what are the symptoms to be looked for. And when you have such, you need to isolate yourself because the main way of transmitting it to someone else is close contact. This is very different from COVID because COVID had airborne transmission. Here, the transmission is via respiratory droplets, a larger droplets which kind of fall within the room. They don't tend to be carried into the air and into larger areas. So if you are infected, you know someone who's infected or suspected to have infection, definite isolation. Whoever is taking care of them, please maintain good respiratory and hand hygiene. Similar to COVID times, mask, sanitizers, gloves, disposable gloves, and wash your hands regularly. This is applicable for any health scenario, not just monkeypox or COVID-19. As a community, I think right now, currently, we just need to build awareness, stop the spread of misinformation. One of the things I wanted to point out during this session, because I read across some news articles, was this is transmitted sexually. No, it is not a sexually transmitted disease. It doesn't spread via homosexual or heterosexual intercourse. Likelihood of spread in UK that had occurred is because of close contact between the two partners, because of respiratory and skin contact. This does not go via sexual contact. So that is one thing that has to be known. So of course you need to isolate yourself, but this is not a sexually transmitted disease. So overall, the usual precautions, I think we're very well aware of what precautions to take learning from COVID. Similar things to be applied here. Do not panic. We don't have a single case so far. And as and when it comes, I'm sure we'll be able to deal with it because we have measures in place already. So I think use the right source of information, and yeah, if please spread the word across. If you hear someone else talking otherwise and you know better now after this session, please do spread the word about it.
All right. Thank you so much for this very, very informative session, Dr. Ruby. I'm sure, like you ended it on a very good note by saying that, always make sure to check the sources of information that you are actually, referring to, and more importantly, sharing with others. Apurv, thank you so much, Apurv, for your feedback. We're glad that you enjoyed the session, and once you get the recording, do feel free to share it with everyone here. I think that does bring us to the end of the session. Just a quick reminder, Dr. Ruby and lots of other great doctors like her are available for consultations for Plum members on Plum Telehealth. There is a link in the chat box that I've shared. I will also put this in the follow-up email so that you can go ahead and book your teleconsultations. We're available across multiple specialties. We're available at your convenience. So feel free to go ahead and utilize it. And remember, it's not just for you, but also for your family members as well. All right. Thank you so much, Dr. Ruby, for doing this. And thank you so much for joining us. We hope to see you at another session by Plum very, very soon. Have a great rest of the evening and have a great rest of the week.
Thank you, everyone. And good night.
Bye-bye.